This literature review explores the psychosocial challenges among older adults in the lesbian, gay, bisexual, transgender, queer community, or better known as the LGBTQ community. According to the American Psychological Association, 2.4 million people who are 65 years or older identify with this community. Many of these individuals have faced a double stigma of homophobia and ageism, which drives their fear when it comes to the possibility of receiving a higher level of care. This is characterized through a fear of discrimination, mistreatment, or prejudice. Because of these factors, it can deeply affect one's mental health and physical health, leading to more challenges altogether as they continue to age. The first article is titled Social Care Networks in Older LGBTQ Adults, Challenges for the Future. The purpose of this research was to identify various challenges LGBTQ older adults face, with a focus on their social networks, barriers to services, and mental health morbidity. The design of their research involved quantitative and qualitative data analyses. They collected self-administered surveys, which used standardized measures with known psychometric properties to assess various topics such as depression, social networks, functional ability, and needs for services. The results showed that out of 210 people surveyed, 1 out of 5 reported having severe levels of depressive symptoms. However, the research also showed LGBTQ older men were more likely to have more severe symptoms than older LGBTQ women. In regards to social networks and social support, more people reported friend-centered support over family-centered support. With that being said, older LGBTQ women were more likely to have a larger family network, but they were also more likely than LGBTQ older men to report higher levels of negative family support. The next article is titled Lesbian and Gay Elders in Long-Term Care, Identifying the Unique Psychosocial Perspectives and Challenges. The purpose of their research was to understand experiences, perspectives, and concerns of LGBTQ older adults in regards to living in long-term care. They separated 16 participants into small groups to ask various questions about living in long-term care facilities. Some of the questions were, do you think you would be comfortable as an LGBTQ senior in a residential setting? Or how can healthcare providers be more responsive to LGBTQ people? The results showed that there were clear concerns when it came to receiving a higher level of care. 83% of participants described feeling vulnerable as an LGBTQ senior in their neighborhood or facility. In addition to that, 83% of participants also reported they had experienced gay-related rejection from neighbors and healthcare providers. These individuals also voiced 3 major challenges and associated fears when it came to living in a facility. This included the fear of having to deal with roommates who dislike gay people, the fear that one's sexual orientation would result in less than equal care, and the fear of having to be careful not to offend others by being a part of the LGBTQ community. The last article was titled, Fear Runs Deep, The Anticipated Needs of LGBTQ Older Adults. The purpose behind their research was to gain insight on the complex fears and needs of LGBTQ older adults with respect to healthcare. They performed their research by facilitating group conversations with questions regarding concerns and wishes when it comes to healthcare. Participants also had to answer a questionnaire about living arrangements and demographics. The results highlighted many concerns that need to be acknowledged within many healthcare settings and other services. There were 2 primary areas of need. This included the need for LGBTQ inclusive settings and LGBTQ trained and sensitive staff. Another large area of concern was cognitive decline and dementia. Many participants expressed fear of whether they could entrust their safety and well-being to healthcare providers. They questioned if their providers would be understanding enough to respond appropriately if they were to regress to a time when they were not closeted or identified with their birth gender. Another area of concern was suicide, which was brought up in conversations regarding bias, discrimination, violence, and fear. Many participants shared feelings of loss, loneliness, and isolation. Overall, these articles touch on several topics that need to be addressed in many healthcare settings and other services. Many of the concerns voiced in these articles are perhaps universally held among older adults in general, yet the LGBTQ older adults' particular needs are unique. A drive for educational institutions and training could support facilities to expand their services to this growing community and promote independence and a decent quality of life in the coming decades.